Improving access to affordable healthcare for all Jamaicans. Government has been working on that, and you will hear more in an exclusive interview with the Health Minister right here on Jamaica Magazine. Also on the show, the summer holiday is fast approaching, a popular period for the spread of conjunctivitis. We'll tell you how to avoid pink eye this season. Hello, I'm Arroyo Eubanks. It promises to be an informative show, so stay with us.
Jamaica welcomes delegates and stakeholders attending the 6th Biennial Diaspora Conference, now on at the Montego Bay Convention Center. Jamaica and the diaspora, linking for growth and prosperity.
There has been significant reduction in wait time at health centers as more Jamaicans are being cared for. Minister of Health, Dr. Fenton Ferguson, is this week's guest on Issues, providing critical answers on the nation's health sector.
Thanks for joining us for Issues and Answers. I'm Ian Boyne. Today we discuss important health issues. We have with us the Minister of Health, the Honorable Fenton Ferguson, and we hope to put to him some of the issues on your mind and to get some answers. We thank you for your company. Minister, good to have you in studio.
Happy to be with you.
Good.
Ian.
You recently made a statement about reducing the misery level in the hospitals, the misery index, addressing that. And a lot of people can relate to that. Their experience in the hospitals, Minister, is anything but delightful or even satisfactory. What is being done?
All right. We have to start at the level where there are thousands of persons passing through the hospital system. And oftentimes you get a complaint. It represents a minority number, but it is a real complaint. And we believe that you cannot have a success story, and while you are building that story, you have persons who are, health workers who, for whatever the reasons, might be doing things, or you might have, by virtue of not having proper inventory, you are have shortages in the area when, in truth and in fact, whether it's pharmaceutical, whether it's gauze, whether it's needle, we have in the country, but in a particular hospital or health center, you're short on that. So what I've done is to say to my 4 regional chairs, get out there, do this audit, get back to me, so that we can look to see where we have the gaps, and where the gaps exist, we must now fix it, or at least based on the budget we have this year, start to fix it. We also believe that while you are doing that in terms of, your pharmaceutical, medical, sundry, etc., you also have to be looking at how we fix in relation to our customer care policy. The relationship between health worker and client or patient. Equally well, we are concerned about our patients or client, dealing with our health workers in a particular kind of way. So it's a two-way street, but we are ensuring that we have a customer care policy that will have sanction relative to our workers, even as we make special appeal to clients.
So there'll be greater attempt, Minister, to manage the resources and to ensure that the hospitals are supplied and health centers,
yes,
with the necessary.
Yes, we want to definitely have greater efficiency within the system, because you see, your governance and the efficiencies that you bring to the system, especially in a very tight period, is important in terms of outcomes.
But wasn't the regional system supposed to enhance this, or that itself has become a problem now?
No, well, you have issues, but I think we are making some stride, because for the first time, you're having almost bi-weekly meetings between the 4 regional chairs.
Okay.
So you're getting on this a kind of same play field because they are governed by the same Health Services Act of 1997. And it is my view that we are getting better. There are some issues related to human resource, overlapping of functions, etc., which we're going to be looking at in the whole health reform.
Yes.
But essentially, we are of the view that there are still some gaps, there are some challenges, and this is why we appeal to the population, because you have 24 hospitals, you have over 300 health centers, and it is not a simple thing to manage all of this. But in a real sense, once we start to move towards the renewal of primary care, which is, we have gone far. We have repair or build over 129 health centers. We have another 8 that is ongoing in terms of infrastructure. We are improving the numbers. You know, we have had to go into a relationship with Cuba. We have had Cubans coming here, doctors, nurses, specialist nurses, etc. And we have brought in dentists now for the first time. And we are bringing in some other kinds of specialists. But we are also using, outside of what we are doing, Ian, we are now trying to pull together that pool of persons from the diaspora. Missions. In 2012, we had 172 medical missions visiting the country, saving us, millions of dollars in terms of pharmaceuticals, the manpower. By 2013, we had 197 medical missions. Last year, we had 182. I'm just coming from the University of North, I can't remember the last name, but they have been coming to Jamaica for 14 years.
Okay.
And they're now working with this Seventh-day Adventist Church in a particular program where they will have dental surgeon, they'll have ophthalmologists, optometrists, all of that. So we're using...
You're drawing on all the resources.
On all
possible.
the resources. I put in place a
I'm going to take a break
tank.
now. Minister has so much to say on this critical issue of health, and we'll allow him to say more when we come back from this very short break.
Measles, mumps, and rubella are potentially dangerous childhood diseases. Parents, ensure your children get the MMR vaccine to protect them. The first shot should be given when children are between 12 and 15 months old, and another before they start school. Women of childbearing age should also ensure they get the MMR vaccine, as they could transmit dangerous conditions to their children if infected while pregnant. To know more, visit your nearest clinic or health center or contact the Ministry of Health.
Minister of Health, Fenton Ferguson, addressing your questions and giving the answers that are appropriate. So you are encouraging people, Minister, to go to the health centers.
Yes.
Not just the hospitals. There are a number of things that the health centers can deal with.
Absolutely.
That people are crowding the hospitals for.
And in this attempt...
And it's not substandard care at the health centers.
Absolutely.
But people wonder,
and
whether...
we have introduced 4 centers of excellence for the first time. And we did that in the post-2012 period. One at Isaac Barron, which was one of the hospitals that were closed in 1980. We have the Santa Cruz Health Center in St. Elizabeth, Claremont Health Center in St. Anne, and Darliston in Westmoreland. 4 centers, new concept, and the expectations, they will emerge like small community hospitals, doing, diagnostic treatment in essence, ECG, as time go by, X-ray, and doing minor surgeries, ambulatory surgeries, etc. But what we want in this movement now with the primary care renewal program. We are looking at population and demographics to determine in a real sense how you now reconfigure these health centers. And by virtue of that, you'll find within your township, within the more densely populated area, you're going to have configurations coming out that is more responsive to the people. So you don't have to go to the hospital or the emergency room for some simple things. Things
But are you
that,
thinking of extending the hours of the health centers?
That I believe in due course, especially some critical ones.
Yes.
We believe that we're going to be moving in that direction. Just as we are now, even at Santa Cruz and Darlington, two of the centers of excellence, we have started to implement electronic patient administration system, which is really leading towards electronic medical records. So the paper-based thing that you get a lot of complaint, persons go to clinic or go to hospital and hear that, you know, them can't find your docket. And it's a cost to the government because you have to now redo the examination, trying to recapture a person's history, which might have been 5-10 years or even more.
Yes.
There are a number of areas of efficiencies that we're moving towards to encourage and to get people. It is less per capita to go to a health center than to go to the hospital for each patient. So it is also effective in terms of value for money.
Yes.
It is community-based. So you walk from your home or take off in 2 minutes, you are at the clinic. And we know the problems that they face now. We're looking this year getting about another 250 doctors coming out of the University of the West Indies.
Yes.
And as you increase that cadre of health workers, you'll be able, and we are moving towards getting those persons to mandatory spend some time at the primary care level. And all of that, I believe, is going to add value and quality to the service as we go by.
Minister, what hope is there for the many persons who are on the long list for elective surgery? People whose surgery have been put off over and over. We heard recently a man, 3 years, been waiting, you know, begging for his life now.
That is,
lots of people, critical things,
that is
Minister,
one of the things.
They need the surgery.
Part of my vision is that when we reconfigure primary care too, that you'll be able to do some of those ambulatory surgery, little hernias and all that, with people waiting for 2-3 years. But immediately, we're looking now, I know certainly in the southeast region, to have some Saturday surgery. And we really want to focus on some of those cases.
Yes.
And even extended hours relative to surgery.
Yes.
And
you're
that's
looking at
part,
that, extended hours for surgery.
Yes, and that is part of the conversation that is
right.
taking place. Even as we are saying, you have to increase theatre in some areas. Right now, I am pursuing doing 2 new operating theatre at St. Anne's Bay Regional Hospital.
Yes, St. Anne's Bay needs it.
And that's a big, we're spending over 300 million now.
Yes.
We have just completed a female medical ward, $136 million at St. Anne's Bay
In fact, last year, Minister, your ministry spent enormously on infrastructure.
Absolutely.
When I was looking at the figures, I was baffled. You remember the total?
Because I think we would have spent in relation to hospital over 400 million last year. But overall, for the last 3 years, we have spent in the region. In fact,
no,
400. I tell you, it is ongoing, but it's about 1.1 billion.
That's what I remember.
Yes, it's about 1.1 billion, because those projects are ongoing into this year, inclusive of what is taking place at, say, St. Anne's Bay, you know, and so on. So we are moving in a direction. This year we're spending over 400 on primary care infrastructure.
Yeah, but a significant increase in your budget this year.
This year, our overall budget is 50 billion, moving from about 40.7 billion.
Yes.
But our recurrent budget has increased by 7.2 billion. And so we have been able to an additional $4 billion towards pharmaceutical. We have been able to move our maintenance. You know, maintenance is a big problem. Things are down,
That's
equipment
right.
down.
Yes.
Last year we had $80 million. This year we have 500 million for
500 million from
500,
80?
moving from 80 to 500 million.
Wow.
And
So you have to come back next week. We have more things to talk about. A lot has been happening in the health system that needs to come to the fore. So next week, the minister will be back for us to continue this conversation on health. Until then, Ian Boyne wishing you a pleasant day.
Each time you're not paying full attention to the road environment, the greater your chances of getting in a crash like that. Plan routes to avoid focusing on GPS systems, prevent children from roaming in motor vehicles, turn down the volume of car stereo systems, pull off the roadway if you have to use mobile devices, do not read, watch television or eat while driving, avoid multitasking, and keep conversations with other passengers to a minimum. Whether you walk, ride or drive, avoid potentially fatal distractions.
Acute viral conjunctivitis, commonly known as pink eye, is an infection of the conjunctiva or the eyelids. Ophthalmologists say when the conjunctiva becomes irritated, the blood vessels in the eyes get bigger, making them appear red in color. This infection usually takes from a few days to 2 weeks to clear up. Dr. Donovan Calder, consultant ophthalmologist at the University Hospital of the West Indies, UHWI, says there are many causes of conjunctivitis.
It can be allergic, it can be due to an infection. An infection can be viral, bacterial, chlamydial, or it can be due to chemicals, if you get a chemical burn. So that's basically what a conjunctivitis is. You may have it in adulthood, or you can sometimes have it as a neonate, that is as you're at birth, and it's called neonatal conjunctivitis.
Investigations by the Ministry of Health have so far revealed that a virus is the cause of the recent outbreak of acute viral conjunctivitis, or pink eye, in the country. Viral conjunctivitis is very contagious and usually spreads rapidly in schools, workplaces, and nurseries.
It happens from time to time. We've had several outbreaks over the years. And it's a particular type of virus that causes. It's called a picoRNA virus. It's a small virus, and one of them is a Coxsackie 24. And from time to time, we'll have this outbreak of the first one described in 1969 in Ghana. And it's also called the Apollo eye disease.
Dr. Calder pointed out that while most types of conjunctivitis are contagious, they usually are not a danger to the eye or to a person's vision. Some of the symptoms of acute viral conjunctivitis or pink eye are discomfort in the eyes, pain in the eyes, redness of the eyes, scratchy and or burning eyes, grainy feeling in the eyes, swelling of the eyelids, watery or pus-like discharge from the eyes, sensitivity to light, and blurred vision. Ophthalmologists say because of the contagious nature of the infection, it may be nearly impossible to prevent the spread of acute viral conjunctivitis or pink eye among children and adults in the same household. However, Dr. Calder mentioned some of the persons who are at high risk of contracting the disease.
Usually it's the young persons who are out and about, touching people, rubbing their eyes in crowded places. And so it's a young, active person who is, if you're at home, homebound, then it's unlikely that you'll get it.
The virus that causes the disease is found in the discharge of mucus from the eyes of an infected person. Persons who have pink eyes or acute viral conjunctivitis can pass it on to others with whom they live, work, or have close association. It's spread through the items that come in contact with infected mucus, such as the fingers, doorknobs, tissue, wash rags, and clothing. To prevent acute viral conjunctivitis or pink eye, you must wash hands with soap and running water frequently. Avoid rubbing and touching the eyes. Disinfect areas touched by infected persons. Do not share personal items such as wash rags and towels. Avoid crowded areas. Do not share eye cosmetics. Change pillowcases regularly. Do not share contact lenses. And if you get pink eye, you should stay at home, away from schools, nurseries, daycare facilities, and the workplace for at least 1 week. Dr. Calder said educators should be vigilant to prevent outbreaks of pink eye or acute viral conjunctivitis in all educational institutions. Any case of the disease, he said, should be reported to a doctor or any health institution immediately.
In any situation where you have somebody with something like this, where the chances of passing it on, as you already mentioned, nurseries, schools, and workplaces, it is best if these children are kept at home or kept away. Otherwise, it's going to spread through the rest of the community, because it's difficult to keep children away from touching each other and from sharing things. Usually, it is said that the actual conjunctivitis lasts for about 4 to 6 days, but we know most of these viruses, the course will go from anywhere between 5 to 15 days. So 10 days, I usually recommend about 10 days away from work and away from contact, and you're safe.
Ophthalmologists say there are no complications associated with acute viral conjunctivitis or pink eye, and the disease is usually confined to the eyes.
There are other viral conjunctivitis, however, which may cause you to have a fever and sore throat. And some of them will have, like about 2 weeks later, the eye then becomes red and painful, where you have now an allergic type response to the virus. But in the case of pink eye, this is not the case. So usually it's really just confined to the eye. And in a few days, you'll be okay.
Once the symptoms of pink eye are detected, the individual should visit a doctor or any health institution as soon as possible for proper treatment. However, Dr. Calder says viral conjunctivitis does not require treatment with antibiotics either orally or topically. The disease usually has to run its course.
So the treatment is really symptomatic, to relieve the discomfort and to prevent secondary bacterial infection, or if it has occurred, to treat it. So for the discomfort, one uses things like an ice pack or cold compresses on the eye, which will reduce the swelling and stop the pain and itching. Decongestants, which are some drops which may reduce the redness, so the dilated blood vessels. And if you have a bacterial infection, then you may need an antibiotic.
Dr. Calder is advising against the use of home remedies for the treatment of pink eye, which he said may lead to dangerous complications.
One can understand people trying that because you may not have ready access because you're busy to a doctor, or you just think it's not severe enough that you should go, but you try something at home to relieve the discomfort. I've already outlined some of the things that you can do. In addition, you can make saline at home. You boil the water for about 10-15 minutes, cool it, and then use a teaspoon of salt or 8 ounces of warm water. So you make a little saline solution. And you can use that to wipe away the mucus and so on from the eyes. Outside of that, if you're going to use drops or prescribed drops, do not use old drops that you've had at home, which may have been prescribed for somebody else, and you have a little bit left and you're going to try some of it because it worked for your son or your daughter or yourself. That's not recommended. Things like lime juice and urine and dew, water, and those, I would not recommend those things, because then you're running the risk of now infecting your eye, which is under stress from this virus with a bacteria, which can now get into the eye and cause severe problems. And I've seen it happen where people have lost both eyes by using things like that. While if you waited for another 6 days or 4 to 6 days, your symptoms will subside.
So, remember that to treat a pink eye infection, you must visit a doctor or nearest health center for immediate treatment. Avoid crowded places such as schools, nurseries, or workplace. Avoid person-to-person contact. Wash hands properly before and after using eye drops and each time you touch your eye or face. Wash any clothing that was touched. Get rid of old makeup and cosmetics. Avoid touching and rubbing your eyes. Use clean pillowcases each night. Wear sunglasses if your eyes are sensitive to light, and avoid wearing contact lenses while using medications or if eyes are uncomfortable.
My general advice would be to practice simple hygiene, hand washing. If you are in a profession or in a situation like a barber or a beautician and so on, you have to clean your instruments properly by using, you can use a dilute bleach solution. 2% bleach will do quite well. It won't damage your things and it will take care of most of the viruses for you. If you happen to have pink eye, avoid crowded places where you know you're going to spread. Do not be a little antisocial. Don't shake anybody's hands for a while. And don't share your personal effects.
However, Dr. Calder says research has shown that the current outbreak of pink eye is not a health threat to Jamaica. He said those who have contracted the disease should relax and use the medication prescribed by their doctors.
I wouldn't call it a threat. It's just something that has happened over the years. And as long as I've been involved in ophthalmology, from time to time we have had outbreaks and they usually subside. The complications we see are usually from people doing the wrong things by using some unsuitable home remedy.
If you have conjunctivitis and your condition does not improve with treatment, revisit your doctor or nearest health facility as soon as possible. The Ministry of Health has taken steps to heighten surveillance, education at clinics and other health institutions and settings. Reminders are also being sent to physicians on the management of the condition. For further information on acute viral conjunctivitis or pink eye, consult your doctor or any health clinic near you.
Burning garbage can be dangerous. We all have a right to a clean and healthy environment, which includes the air we breathe. Clean air is life-sustaining. Without it, we won't have long to live. It's important, therefore, that all of us protect the health and life of each other by not contributing to the pollution of the air around us. We must be mindful of the discomfort and resulting illnesses from toxic, hazardous air pollutants. Take, for example, the act of burning our garbage, which we often take for granted. This can cause serious respiratory illnesses, cancers, and even death. Ever hear the saying, "And a same day leaf fall a river bottom it rotten"? Similarly, it might not be the same day you inhale air pollutants that you fall sick. And when you do, you'll be burdening your pocket to get well and straining the health system, something we can avoid. So next time you plan on burning your garbage in your yards or anywhere that it would pollute the air, don't. Let's keep Jamaica's air healthy and help make Jamaica the place of choice to live, work, raise families, and do business.
Everybody make we join the light celebration again independent time. A big day here since we get free of rebel in the world scene. Everybody make we join the light celebration again independent time. Make we go on the floor, them go report and go to Jamaica too.
Give me what the queen festival show, and everybody go to. Give me what the queen festival show, nobody go to. The festival is over.
Our last tip to you on health. It is health that is real wealth and not pieces of gold and silver. Words from Mahatma Gandhi. The information continues to flow on our website, jis.gov.jm. You may also follow us on Twitter at JIS News. Our YouTube channel, Watch JIS, has loads of videos and interviews. We'll be back on your favorite TV station tomorrow. Until then, I'm Arroyo Eubanks. On behalf of the hardworking team here at the JIS, have a wonderful Sunday.
This has been a production of the Jamaica Information Service, the voice of Jamaica.